Isabel. Welcome to the office. It is very nice to meet you. Thank you for coming in. I know you were in for a little bit of a concerning reason today, so I do want to assure you that I will do everything I can to figure out what's going on, okay? Alright, so just to confirm a little bit of information with you, your name obviously is Isabel, so I do have that you have your cat at the bedside, and this is baby cat. Beautiful. Welcome to both of you. And it looks like the reason for your visit today is that you had an annual exam with your gynecologist. So you had your normal, regularly scheduled pap smear as well as a breast exam just to make sure that everything was okay. And unfortunately, your breast exam was abnormal. So I have a couple notes here from, it looks like you had your annual done by a PA, so a physician's assistant. And is that the PA that you normally see? You see her every year?
Yes.
Okay. All right, so it looks like she stated that she'd like to refer you to a specialist just to make sure that there's nothing going on. Looks like you had a little bit of abnormal nipple discharge as well as just some tenderness of your left breast. Okay. And I have it notated here that the nipple discharge is something you were unaware of until your visit with her. Breast tenderness you thought maybe was related to your period, but you're not quite sure, so we want to just have a look. Okay. Alright, so all of that sounds pretty standard. Just to give you a little bit of a background, you're welcome to call me Sarah if you're more comfortable. Dr. Perez is also fine. So I am a women's health specialist as well as a breast specialist. So essentially what I do is specialize in breast health. I do also perform pap smears, but I do have more schooling in breast health. So that's why physician's assistants as well as doctors tend to send their patients to me just so I can have a little bit more of an in-depth look. So I perform the physical portion of the examination as well as the preliminary assessments. Should we need any imaging, which I likely will send you out for today, we have that down the hall, so you can do that in-house as well, so you won't have to leave. I'll probably order you a mammogram just so we can have a look internally, and when I'm done, you can just go around the corner. I'll escort you over and get that done here, okay? I know they said this was a little bit of a drive for you, so totally understandable. I don't want you to have to go to a third office, of course. Okay, all right, so we do want to go over just a couple things with you to kind of alleviate some concern before we get started. So I'm just going to be setting my clipboard here, if that's okay. And what I'm going to do is just get a couple of things out here. So let me go ahead and place my gloves on, just as a start. And then just to give you a little bit of a demonstration, because this examination is a little more in-depth than what you have on your annual, I have an artificial breast here. So this is meant to mimic breast tissue. You're welcome to feel it. It does feel pretty similar to your natural breast tissue. And this is just an educational tool that I'll be using to show you a little bit of what I'll be performing on you today, okay? So obviously, there's no actual anatomy here, but I want you to just picture that the center of this is your nipple. So let's say nipple is midline. Areola obviously is the circular region around that. So just to give you a little bit of a better example of that, we'll say about here. So nipple and areola, and then the rest of that is your normal breast tissues. If we broke this up into 5 quadrants, this being the nippular area, this would be your upper inner quadrant. Quadrant 2 would be upper outer, 3 is lower inner, and then 4 is lower outer. And then we have a 5th that's not quite shown if you picture kind of your axillary armpit area. That is your axillary tail of Spence up here, okay? So for today's examination, I will be examining all 5 areas. And just to give you an idea, I'm going to be moving my index and middle finger in kind of a circular motion, the pads of my fingers. So you'll feel me moving around in a circular motion like this, as well as in a linear motion, and then a wedge motion side to side as well. And all of that is just to ensure that I'm not missing anything, okay? So should you have any lumps or lesions, any abnormalities in that sense, I will be able to feel it as I'm moving in every direction, as well as up into the axillary area, which would be your underarm, okay? So does that give you a little bit of a better idea of what we'll be performing today? Okay, perfect. So let me go ahead and put this away. And we can move on to the visual inspection portion of your examination. So what I'm going to do to start is just have a bit of a visual inspection of the breast itself. Now, for today's purposes, I am only looking at the left breast, as obviously the right one is not determined to be affected. So I'm just going to be using a light. This is a little bit of a magnifying glass. It will allow me to have a little bit of a more up close look. So is it okay with you if I have a look underneath your gown? I do have you in a privacy gown, so you won't have to take it off. I can just kind of Velcro it and have a look inside to give you a little more coverage, okay? Okay. So if it's all right with you, we do need to move baby cat just slightly so I can access the area. All right, Isabel, so I am just going to move slightly closer to you, and in order to expose the area, I am just going to undo the Velcro here. So excuse me. And of course, if at any point you are made to feel uncomfortable or you just no longer wish to continue with the examination or you would like to pause, you're welcome to just let me know, okay? So you can either say no or please stop or just move my hand, whatever makes you more comfortable, okay? So I'm going to start by simply lifting this up just to better visualize the area. Perfect, okay, so I do have full field of vision of your left breast. And using my light to illuminate the area in its totality so that I can see all 4 quadrants. And what I'm looking for at this point is any area of abnormality. So in comparison to the model breast that I showed you, which is very smooth and kind of spongy almost texture, we're looking for any ridging or any lumpy areas, any areas that are very obviously abnormal in texture externally. Also looking for any signs of erythema, which is redness of the breast. So if we were to see reddening of the skin or any blistering, things like that, could also be cause for concern. So just having a look around, notating anything that I see that could be a cause for concern. So far, everything externally looks okay. Don't see anything that's acutely abnormal, which is a good sign. No obvious lumps or bumps. And no signs of asymmetry in the breast or kind of an oblong shape that would be concerning. So breast is round and fairly symmetrical, which is good. So if I can have you place your left arm just above your head, I'm going to be having a look at the axillary area. Perfect. So again, just using my light to have a look here. Looking for any notable abnormalities in this area. Any signs of abnormal discoloration or again the lumps or bumps, which I'm also not seeing, which is a great sign. All right, you are welcome to go ahead and relax your arm. So the next thing I'm going to do is an examination of your nipple. And the reason for this is they did see that abnormal nipple discharge when they performed your annual examination. I'm told it's like a grayish color and a little bit of a sticky texture. Now you said that's not something that you noticed prior to that examination, correct? Okay, so I have a couple things here that I will be using to obtain a sample of that discharge if we are able to extract it. So I'm going to go ahead and get this stuff ready. And essentially what I have here is just a couple swabs. So these are sterile swabs, as well as a tube with a liquid in it that will just allow for a positive reaction once we send this over to the lab. And I will place the rest of the swab in this cup and send all of that over to the lab in a bag so that they can do their proper testing, okay? Obviously, I'm not a chemist, so I'm not exactly sure what they'll find from that, but it is imperative that we send that over. So I'm going to go ahead and perform that portion of the examination first, if that's okay with you. It is the most invasive, so I'd like to get it out of the way if we can. Okay. Alrighty, so let me just go ahead and open this. And there are 2 swabs here. The first of which will be sent over in this tube. So I'm just going to get that ready. Okay, so what I'm going to do is reach underneath the gown. I am going to slightly pinch the nipple in an effort to extract the discharge. If I'm not able to do that, then I will kind of express, as you would if you were breastfeeding, I'll express the ducts just slightly to get that discharge to come out so that I can get an adequate sample, okay? So I'm just going to go in and attempt to get a sample here. So just going to very gently stimulate the nipple here in order to get it. Okay, and I am already seeing a little bit of that discharge. So you are going to feel my swab just gather that discharge here. Perfect, okay. And just carefully bringing that out in an effort not to contaminate the swab. And it's just going to go right in this tube. And we'll break that off. And we've got one down. So let's go ahead and collect the second sample. Okay. Perfect. Same thing. Going back in. Perfect. And I'm just going to place that in this container. Okay. And both of these will be sent off to the lab together. So I will just make sure they're closed tightly. They send over in a tube system, so I like to ensure that they're closed tightly so that the samples are not affected when they're being transported. Okay, so as soon as we're done with your examination, I will print your labels, put them inside, and we'll send that right over, okay? Now, these results do take an average of 7 to 10 days to come back. I know that can be a little unnerving. That's kind of a long time to have to wait for your results. So I do apologize for that, but it's only because we want to make sure that the lab is able to get an adequate result reading, okay? So of course, all of that will be updated to you as soon as I have the information and I'm able to go over it. I'm just going to notate that we did perform your examination of that today. Now, since we have already performed the swab, the next thing I'm going to do is move on to test for nipple stimulation. So I have a device here that is very cold. It's been kept in the freezer. And what I'm going to do is just gently touch this to your nipple 3 times. And essentially I'm just testing to make sure that you have a normal reaction. So there are several nerve endings and I just want to make sure that they are not misfiring, which could indicate something else is going on, okay? So it is very cold, I do apologize, but it's just very quick. 1, 2, 3, should see an automatic reaction and then we can move on. Okay. So going in here and So very healthy reaction there, which is a good indication that there isn't anything wrong with the nerves. Okay. So this was part of our demonstration tool earlier, and this also will help me measure your areola for an average measurement here. So this has been measured to the average size of an adult female. So I'm just going to place it against your breast, and your areola should fit somewhere either below or above the ring, as long as it's within a close proximity, okay? Okay, so just going in here, and good, so you are right at about average, and I'm not noting any signs of asymmetry in the areola itself. It is very circular. There's not any abnormal ridging or anything like that. So it's a similar shape here, which is a good sign, okay? Very good. Okay. So the last part of our examination today, Isabel, is going to be the actual palpatory exam. So this is the part of the examination that I showed you the demonstration on, where I'll be using my fingers to kind of manipulate the skin and move around the 5 quadrants to make sure that I'm not feeling any of those lumps that we were talking about. Okay? So again, you're going to feel my hand, my first 2 fingers. If at any point you'd like me to stop, please let me know immediately, okay? Okay, so I'm just going to make sure my placement is correct, and I will be looking on top of your gown as to provide privacy. So starting with quadrant 1, circular motions, and linear. Good. Okay. Moving on to quadrant 2. Feeling anything here. Moving up in quadrant 2 towards the clavicle and back down. Good. Okay, so I'm going to move down to quadrant 3, which is bottom. So lower inner quadrant here. Circular motions. All of that does feel fairly normal. So it does feel that you have slightly fibrous breast tissue. Okay. So moving to the lower outer quadrant here. And again, I am feeling some of that more fibrous tissue than what I would consider normal. So far not feeling any lumping or lesions, but it does feel as if your breast tissue is what I would say is thicker than maybe normal, okay? Okay, so moving up towards quadrant 5, which is the axillary region. So once again, I'll have you place your left arm up above your head. Perfect. And just feeling around this area. Feeling, this is a little bit of a deeper palpation I am feeling along your chain of lymph nodes that you have that run under your arm. And if I can have you take a deep, deep breath in for me. Okay, go ahead and breathe out. One more time. Okay. So I do actually feel a very small lump in this area. It is about quarter size. Is that painful to you at all? No? Okay. And it's not something that you felt at home, maybe while you're in the shower? Okay. Slightly malleable, a bit asymmetrical in shape and texture. So I'll have you keep your arm there for me. I'm going to use my stethoscope to listen to the area. This will help me rule out an indication of possible blood clot or cystic tissue. So there is healthy blood flow to the area. I'm not hearing any notable occlusions, which is a good sign. Okay. Okay, you can go ahead and relax your arm there as well. Perfect. Okay. So that conclude our portion of the examination. So I don't want to alarm you, but as I stated, I did find a very small, about quarter size lump underneath your left axillary area. So I am going to be sure to notate that pretty thoroughly. So what's going to happen at this point is I will speak with the radiologist. I will have him perform the examination. So typically if it's what I would consider a normal exam, we'll have an x-ray tech perform it, but because it does feel slightly suspicious to me, I would like the radiologist to perform the examination for you. So he'll do something a little more in-depth. They'll take quite a few images, have you maneuver in certain positions, bend over, lean back, arm up, arm down, that kind of thing. Just to give you a warning, it is slightly uncomfortable. It does pinch tightly on the breast. In order to get a good image of the breast, it does have to compress along all sides, and a lot of women do find it kind of uncomfortable. So I do want to give you just a fair warning there, okay? Are you comfortable having those images taken today, or would you like to come back?
I could do it.
Go ahead and do it while you're here. Okay. So I don't want you to worry. There's no cause for concern as of yet, as we don't know what it could be. It could be a cyst. It could be an abnormal lump, something that's benign. We really have no way of knowing until we get the imaging back, okay? So try not to stress. We'll figure it out for you, and obviously we'll move on when we get a little bit of a better picture, okay? Okay. So let me put these away. I'm going to send this over to the lab, and then I will escort you over to imaging. Okay? All right. Give me just a few minutes. Thank you.